Pulse Talk, bringing insights into health and wellness with your hosts, Christine and Alex.
Okay, let's unpack this. Think about that situation. It's pretty common where you're talking to an older relative, maybe your aunt or your grandmother, and suddenly they show a crack in that sort of usual stoicism. They admit they feel this constant, just bone-deep tiredness or anxiety about forgetting things, simple things. Or worse, maybe they just don't enjoy their old hobbies anymore. Our source material really highlights how these silent emotional struggles, anxiety, depression, even just general fear, are so detrimental. And they're often just dismissed, right, by families, sometimes even doctors, as just part and parcel of aging.
Oh, absolutely. It's a huge oversight, really. And these struggles, they can actually speed up health decline. What's fascinating, though, and what the sources point to, is that the key intervention point isn't always a specialist's clinic. Often, it's much closer to home, the community pharmacist.
Right, the pharmacy.
Exactly. So today, we're diving into the sources to pull out maybe 4 critical ways the pharmacist is really positioned to be that super accessible first line of support, going way beyond just handing out pills.
That's our mission then. So let's start with maybe the science bit, identifying triggers. How exactly do pharmacists, who we mostly think of as medication experts, right?
Yeah.
How do they get involved in looking at mood disorders?
Well, the first couple of roles are really about observation and, critically, medication safety. Pharmacists are trained in behavioral observation. They can also use basic validated screening tools like the Geriatric Depression Scale, the GDS.
Yes.
Yeah, it's not some complex psych evaluation. It's basically a simple questionnaire designed specifically to flag depression symptoms in seniors. But honestly, their most powerful tool is that medication review.
Okay, let's dig into those medication side effects, because this is where I think the source material gets really specific and, actionable. What are some common meds that might be sort of unknowingly fueling depression or anxiety?
Yeah, it's pretty astonishing sometimes. We often blame age for fatigue or mood swings, but, well, it can be the pills themselves. For instance, corticosteroids, like prednisolone, notorious for causing sleep problems, significant mood swings. Sometimes that looks like anxiety or just irritability. And then you have common beta blockers, often for heart conditions. They're frequently linked with just general fatigue, which, looks a lot like a key symptom of low mood or lack of motivation in older adults.
Wow. So when you combine those effects with polypharmacy, needing to take multiple medications, it almost sounds like a chemical cocktail that could make emotional difficulties worse. How effective can the pharmacist really be in, stopping the problem?
Through deprescribing, maybe.
It's absolutely vital. Think about it. Anxiety, depression, they reduce focus. So medication adherence, taking the right pill at right time, becomes a nightmare. Pharmacists are the experts here, managing doses, preventing drug interactions, and, yes, collaborating with doctors to deprescribe.
Deprescribe. So suggesting stopping or reducing a med. Exactly. Suggesting that maybe a medication isn't needed anymore or it's causing problems. The sources show that when pharmacists send clear, evidence-based recommendations to the physician, that collaboration, that's really key to improving quality of life related to medication.
Okay, so that brings us past the prescription meds to more holistic support. That's the third function you mentioned. What about non-prescription supports? What do the sources recommend for those maybe earlier stages of emotional decline?
Right. We're looking at evidence-based lifestyle changes and supplements here. Pharmacists can guide people on specific nutrients. Omega-3 fatty acids, for example, are key for brain health, neural pathways. Magnesium can really help with relaxation, sleep management, and maybe most importantly for seniors who might be indoors a lot, vitamin D.
Vitamin D. Because of less sun exposure.
Precisely. Deficiency is strongly linked to low mood and fatigue. It's quite common.
And the lifestyle advice. Sounds simple, but probably effective.
Simple, yes, but transformative. Encouraging physical activity, even short daily walks, is crucial. Gets those endorphins going. And diet-wise, the sources specifically mention a Mediterranean-style diet.
Mediterranean diet. Why that one specifically? What's the connection?
Well, the focus is anti-inflammatory. It's high in antioxidants, healthy fats, This doesn't just help the heart. It directly impacts brain health and mood stabilization. It might help reduce some of that systemic inflammation, sometimes linked to depressive symptoms. It's all connected.
Right, an integrated approach.
Yeah.
Which leads straight to the fourth role, which you said is maybe harder to quantify, the compassionate ear. Why is the pharmacist so well suited for this?
Accessibility, mainly. You don't usually need an appointment. It feels less high stakes than maybe a doctor's office. And sometimes older people feel like they're burdening family if they share fears. So creating that safe, low barrier space right there at the counter for an open conversation, that's often the first most critical step.
Just having someone listen without judgment.
Exactly. Validating those feelings of sadness or fear. That can be the first real healing intervention, the thing that encourages them to actually seek more help if needed.
So if we connect all this back to the bigger picture, it really shows the modern pharmacist isn't just about prescriptions. They're a vital, holistic health professional focused on overall quality of life, not just managing symptoms. So if you, the listener, or maybe a loved one, are experiencing these kinds of silent struggles, remember that expertise and care, they're often very accessible.
Definitely. For dedicated professional advice managing chronic conditions, getting those medication reviews done, or even just support for mental and emotional well-being, we really do encourage seeking expert consultation. It can make a huge difference.
And if you are looking for that kind of trusted expertise combined with convenience, you might consider visiting Alpro Pharmacy for a consultation. They actually have the Alpro e-pharmacy service too, which offers free pharmacist teleconsultation. Or you can just call their hotline. It's 019-702-1923 for more help.
And maybe just a final thought for you to consider. How many of those common symptoms of aging that we tend to just accept, the fatigue, the low mood, how many might actually be fixable side effects? Just waiting for an informed pharmacist to review those medications.